Hello, my name is Joey Tan. I'm a psychologist with UVA Family Medicine, and today I want to talk about the impact of COVID on the general mental health of our community and nationwide. If we take a look at the state of mental health in the US right now, during COVID, we know from a report that came out last year that anxiety and depression rates had tripled compared to 2019, and 13% of adults were also reporting increased or new substance use during the pandemic. And this mental health burden has been disproportionately affecting young people, people from marginalized communities, essential workers, and caregivers for others. With the patients that we work with in family medicine, we see a lot of the same challenges. The ways in which COVID has upturned our lives has put tremendous strain on people, whether it's people who were already experiencing mental health challenges or those who were doing okay pre-COVID, but are really struggling with the myriad ways COVID can affect us. We can feel our emotional difficulties in our physical symptoms. People who are struggling in terms of mental health often report more pain, more dizziness, stomach issues, other physical health problems. We feel our stress in our body. Sometimes mental health issues can affect people's ability to access care, as the motivation and energy that you need to be able to take care of yourself, make it to your appointments can be sapped when you're already feeling anxious or depressed. When it comes to suicidal thoughts and suicidal behavior during the pandemic, we know that rates of suicidal thoughts are up. A national report had about 10% of adults reporting suicidal thoughts compared to 5% the last time they measured this about 2 years ago. If someone's talking about wanting to die or looking for ways to kill themselves, that's a really big warning sign and a signal that some action is needed to help keep them safe. Similarly, if they're talking about feeling hopeless, being a burden to other people, withdrawing from their friends and loved ones, those are some warning signs as well. And when someone is showing increased substance use, alcohol, other drugs, and other types of reckless behavior, that might be a sign that they're really struggling. It's really important to be direct, to ask directly about how they're doing if they're having thoughts about hurting themselves or killing themselves, while still being non-judgmental. This isn't something that's their fault or a flaw of them. It's just a challenge that they're experiencing. Being really available to listen and willing to listen and showing that to someone is hugely important. As people who are struggling with these thoughts of suicide, they often really want to connect to other people. And of course, there's professional help available to loved ones as well who are concerned about others. The National Suicide Prevention Lifeline is able to be called by loved ones to get some advice about what to do next. And that number is 1-800-273-TALK. The first step is to take a look for the warning signs in yourself and loved ones that you are experiencing some mental health difficulties. So this could be changes from the norm in terms of your mood, your sleep, your irritability, or your just ability to function, to get through your day. Another important warning sign is when you find yourself or you notice someone else using more substances to cope, using them in a way that maybe is taking away from their health as opposed to being in moderation. Once you've identified some of these warning signs, there's a couple things you can do with some of the emotional difficulties that you might be experiencing. One strategy is to take a look at all the things that you're worrying about and try to figure out which ones are under your control and which ones are out of your control right now. I think in addition to that, it's really important to take things one day at a time, to focus on the present moment. Another really key strategy during this time is to find ways to connect with other people and to things that are meaningful to you. there's a couple publicly available resources that I want to mention, which I think are really important. So there's the Suicide Prevention Lifeline, which is a national 24/7 lifeline for people who might be having thoughts of hurting or killing themselves, or loved ones who are worried or about people who are having thoughts about hurting or killing themselves. In the state, there's also the VA COPES Warmline, and they are a statewide resource. It's not a crisis line, but a staff phone line that can give you someone to talk about coping skills, figure out how to activate your sources of support, and really just helping to deal with the isolation that we're all experiencing. So those are two kind of resources that I think everyone needs to have in their phone and in their back pocket.